Welcome to the SIBO Doctor Podcast with Dr. Nirala Jacoby, a US-trained naturopathic physician and director of SIBOtest.com, an online breath testing service and education portal for practitioners. In this podcast series, medical experts join us to discuss functional digestive disorders, clinical practice, and research as it relates to small intestinal bacterial overgrowth and associated conditions. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. If you're a practitioner and want to learn the basics of SIBO, head over to thesibodoctor.com for SIBO education such as the SIBO Fundamentals course, masterclasses, group mentoring, and much more. If you're a patient, please know this information is not intended to diagnose or treat a medical condition. Please ask your doctor before initiating any new treatments. And now, over to Dr. Jacoby and the SIBO Doctor Podcast.
Welcome, SIBO practitioner, to another episode of the SIBO Doctor Podcast. And with me today, I have the great pleasure to welcome Dr. Eric Yarnell. He graduated from Bastyr University. I was still a student when he graduated in 1996 at Bastyr. And he has a long list of accomplishments, so I'll post the whole bio on the show notes, but just a few highlights. He served as a senior and associate editor of the Journal of Naturopathic Medicine. He was a founding member and former president of the Botanical Medicine Academy in Seattle. And he's also the president of Heron Botanicals, a herbal pharmacy providing handcrafted whole plant extracts exclusively to healthcare providers. He's on the editorial board of the International Journal of Naturopathic Medicine. And Dr. Yarnell is the author of numerous texts and articles. And the reason why he's on my podcast today is because he wrote The Natural Approach to Gastroenterology that I refer to a lot and have mentioned on this podcast before. And he also specializes, he's sort of unique in a way that he specializes not just in gastroenterology, but also urology and men's health. So he's written numerous texts about that topic, and also the A to Z guide to drug-herb vitamin interaction. So it's just a long list of accomplishments. So I'm so thrilled to have you on the podcast, Eric.
Thanks so much for having me. And I have to say I'm a little embarrassed my gastro book doesn't have a chapter on SIBO because that was like just barely coming into consciousness when I published it. So
it's true. You're going to have to remedy that situation and add a chapter to it in the third edition, hopefully.
Yes, that is in the works.
Great. Excellent. Well, I mean, as naturopathic physicians, we are no strangers to digestive disorders and have been treating them successfully for a long time. And it's when SIBO came along, for me personally, that it made sense that a lot of people that did not respond to my usual very well responsive treatment protocols just didn't respond or would relapse quickly. So there's a lot more to the story with SIBO, and that's why practitioners are wanting to learn so much about it. Because if it was just about the bacteria, this would be easy, I feel personally. But what I want to talk about today, just as a sort of synopsis, because you're such a specialist with herbal medicines and botanical medicines, and I love prescribing liquid herbs and combination herbs exclusively because I don't have antibiotic prescription rights here in Australia. So you are absolutely the expert when it comes to herbs, I feel. And so I want to talk about SIBO, the antimicrobials that you would consider for gram-negative bacteria. I want to touch on hydrogen sulfide. I want to talk about leaky gut, low secretory IgA, inflammation, prokinetics. And so I'm hoping that we can just fit all this into one little podcast.
Nothing complicated.
No. I mean, you could probably talk about this in your sleep. But before we get into it, remember you being a student. We were on student council together. I think it must have been 1994 or 5, and you were already heavily into herbs. You were, I think, doing something with a herb garden at Bastille, and so how did this love of herbal medicine come about for you?
It's like a little bit mysterious, but I kind of think it actually goes back to my father, who is has the greenest of green thumbs in the world. And he grew up on a farm in Colorado. And yeah, he looks at plants and they are happy and grow, which I did not inherit at all. I cannot grow anything. I'm a little bit exaggerating, but he always made us have gardens. I have 2 brothers, so we, growing up, always had to grow plants. And I found it frustrating because I really was not successful, but I kept trying and I kept trying. But in school at Bastille, I don't know, I really got interested in it. And then Dr. Selena Heron came as a guest lecturer because she was practicing in Arizona and just blew my mind. She knew everything from every culture practically, and just all this information. It just was so exciting to me. And we just really hit it off, and I ended up doing a 2-year kind of residency with her, and yeah, just seeing that herbs could do amazing things. So I largely attribute it to her, but I do think it kind of started with my dad.
And yeah, Selena Heron, I remember her. She was definitely a force to be reckoned with. Yes. And you took over that business, that Heron Botanicals. And I have to say, I have tasted your tinctures at various conferences, and they're just amazing. They taste so incredible. You can feel the energy of the plant when you just put a few drops in your mouth. So, and you have very unique herbs as well, right? You don't just do the usual echinacea. I mean, you have some unusual plants in your repertoire there. Okay, let's get into it.
Thank you for saying that, for sure. And I just want to say, and I probably will bring it up again, is I'm a fervent believer in fresh plants, which is expensive and difficult to do, but it does make a difference, even though that's not really well studied or anything. I don't know. For me, it makes a huge difference. And onward. Here in Australia, we do also have a long history of herbal medicine, and we do have a few practitioners that really stand out with fresh plant extracts, and we have some amazing organic herbal farms in Tasmania. So anytime you come over, head on down to Tasmania to visit those, because they are also pretty incredible with what's available here. So awesome.
Let's talk about SIBO. You call it SIBO, tomato. Let's talk about antimicrobials first. So let me just sort of set the stage for the practitioners. Typically, we do have different treatment protocols that overlap somewhat for hydrogen-dominant or methane-dominant SIBO types. And typically what we've been preaching since the last 5 years is that berberine is pretty effective, very, very effective for hydrogen-dominant SIBO, and allicin or garlic extract, very in high doses, as well as oregano oil seems to be very effective for methane dominance. So and I've been talking about herbs at various conferences, from pomegranate to andrographis to clove to lots of other herbs. But I wanted to sort of hear from you what other potentials you would consider effective for SIBO, and what have you seen effective for SIBO?
So definitely the core of my program is berberine, as you said. And I generally use, what's the name of this product? Berberine Complex, which has the whole plant. So I believe it's a couple different species of berberis, and I think also hydrastis, but it does have a standardized amount of berberine. So, but typically I give 2 capsules of that 3 times a day for a minimum of a month. And I think that's another big question, is how long do you treat for? So I've really seen just too many relapses with shorter protocols than that. And then I've been playing with different essential oils. So I have used the enteric-coated oregano oil. I've used red thyme essential oil. Let's see. I tried cinnamon oil a couple of times. And, I feel like there's one other. I think I have given rosemary essential oil a couple of times. And now I'm kind of playing with the idea of rotating between those, like do a different one each week of that month program.
What would be the benefit of that? Is it just so that we don't see resistance to berberine, for example?
Exactly. Exactly. And just, I don't know, my experience is that there's fairly high relapse rates. So I don't know if it's because my program isn't working or I have other ideas I want to talk about why I think that's happening. But that one of my concerns is, and actually, I think this is controversial, and you brought up garlic. I don't actually use garlic at all. And my concern is that these things have been in our diets for so long that like the normal flora had better be resistant to them. Otherwise, every time we eat garlic, it would be devastating to our colon flora, and clearly it's not. And the thing that makes sense to me is if we were to use sort of like the more concentrated allicin extracts and things where it's, moving away from its food-like form. But I just mostly have stayed away from it. There's also the whole problem that garlic is pretty high FODMAP. And usually in a capsule, it's not enough, I think, to make a difference. But all those things led me to not really mess with it.
Yeah, if I can just interject, that's something that often, I have talked about numerous times as well, where garlic is definitely a high FODMAP. We don't use just garlic as a food during the treatment. We use very high allicin, and I personally have seen very, very good results with methane. I use it very, very often with methane if the patient hasn't tried it before, because I also do before and after testing, and so I can see the effectiveness of that pretty good. I use the Alimax, Alimed Ultra, I think it's called, in America, with about I think 360 milligrams of standardized allicin extract, so pretty potent.
Mm-hmm. Yeah, and that does make more sense to me for sure. So cool. Anyway, like you said, there's differences. And then, so I always do at least those. I always combine them with lactoferrin, and I'm doing 250 milligrams 3 times a day. All these I do 3 times a day, and I'm a real stickler about that because of part of the reason herbs are so safe is that our bodies can get rid of them pretty rapidly. So I feel like if we don't keep dosing, that we're gonna, not see as good a results. I'm pretty strident. And then I've also used peppermint oil. That was the other one I was thinking of. Of course, we have that one case that was published that kind of was interesting, and because we don't often think of peppermint as being particularly antimicrobial, but it is. So
was that for methane or for hydrogen producers?
I really haven't discriminated. I've used it in both.
Oh, great!
So
that's a good
seems
tip. Is that
good.
Just the sort of enteric-coated peppermint oil?
I've used the enteric-coated. I've also just used drops, and then I almost always make a tincture formula for them as well, and so that's where I get to try all kinds of crazy things, and it's real easy to mix the essential oil into the tincture, per dose. But the peppermint oil thing I thought was interesting because, of course, we have several studies of peppermint oil for IBS before SIBO was even ever talked about. And that's led some people to retrospectively kind of speculate, oh, what if the peppermint oil was working because it was affecting, these microbes and not because of its carminative effects.
Mm-hmm.
So that's a real interesting. And that was mostly for patients with IBS-D where they have, a lot of cramping. So anyway, it's kind of interesting.
Very interesting.
So boy, yeah, and the tincture, oh man, do we have 2 hours to list every herb I've ever tried?
I can totally imagine the mad scientist sort of lab that just, with all of your tincture bottles, putting a tincture together. But and maybe now is a good time to talk about that because, as like I said, not my listeners are a mixture of naturopaths, integrative GPs, and nutritionists, patients. So there's only a handful of us who really value the art of mixing tinctures. So I'm not sure how much time to spend on it, but I did want to ask you how you put a tincture together. Just do you go by, what kind of constituents go well together, or, how do you decide?
So with this particular problem, it's a little bit less specific to sort of the patient or their constitution. It's more on the grounds that, again, we just want in my opinion, the widest diversity of sort of different compounds that we can get. So I try to generally choose 4 or 5 herbs from completely different botanical families. And then almost always I put Usnea in there, so it's not even a plant, it's a lichen, and their chemistry is really different than plants. So yeah, that's often what I'm looking at is just how different can these things be. And since I've already got the berberine-containing herbs in the capsule and these various terpenoid-containing plants, a lot of the things I tend to use then are pretty exotic. Again, just trying to get a real diversity, but one plant that I really love to use that's readily available in many other forms are all the different species in the Artemisia genus, and I'm sure, of course, people are aware of wormwood, Artemisia absinthium, and that's available. But in the in the West and North America, we have Artemisia tridentata, which is the big sagebrush. And it's essentially like it's like the main shrub that grows in the Great Basin Desert. So it's really prolific. It's like 10 times stronger than other Artemisias, in my opinion. I mean, it just tastes really intense. And it's just fantastic. Plus, it's a bitter. So, I mean, everyone likes to talk about prokinetics, but I just say bitters. We've been doing prokinetics for forever. We just had a different name. So that's nice. And just really different chemistry from, again, any of these other herbs that would have come up.
I just love that you talked about bitters because that's my favorite. I've been talking about bitter formulas as prokinetic, but I don't actually have any proof. Do we have proof that it is a prokinetic? Is it, or
Absolutely.
just, like proof we know clinically, but do we have the research to show that it actually stimulates the migrating motor complex?
Well, we definitely have a study that was done with ultrasound showing increased gallbladder activity. I know that paper off the top of my head. I think there's a really famous paper where this patient had a esophageal fistula, and they were able to see. Basically, they could scope right into his stomach, and they put bitters in his stomach, and they could see the secretion happening. But I don't remember if they looked at motility. So I guess I couldn't cite a paper off the top of my head.
I'm sorry, I kind of put you on the spot there, but it is such a fascinating. I just love bitters. Almost all of my patients get bitters, and so what's your favorite sort of bitter herb? What's your star performer?
Well, it's, again, for this, I would say it's the Artemisias because they have this great, very strong antimicrobial activity as well as the strong bitter function. And then the Mahonia berberis type would be a close second, which, I'm giving them in the capsules in this case. I fairly often give Achillea or Yarrow because that I don't think is that great of an antimicrobial, but it does have really nice anti-inflammatory effects. So sometimes when patients seem to just be really irritated, it seems like we need a little bit of resolution of inflammation to get, get patients feeling better. What else? Why am I drawing such a complete blank? There's just so many to choose
There's
from.
too many. There's just too many choices. But let's kind of, we'll loop back to the prokinetic issue, but let's go into herbs for leaky gut and low secretory IgA, which is so common in people that have chronic gut disorders and chronic sort of adrenal depletion, where we see low secretory IgA. I'm not sure if you go by stool testing for secretory IgA levels, but I often see that on a stool test that they're just totally underperforming in that department, and as a result have often chronic sort of immune issues and leaky gut as well.
Well, I'll address the leaky gut part first, and then the IgA part. The thing that I've definitely seen most helpful for leaky gut is aloe gel. And I like that also because it is immune modulating. And I think, a lot of patients who have leaky gut, they're having some immune issues because they're absorbing things they shouldn't, and that's triggering their immune system. So it's great that it's an immune modulator on top of that, and it's relatively cheap, and most people find it okay. And I just make sure everyone knows that they can add water to the gel to get it to a texture they like, because some people really dislike the sliminess of it, but it's just like mix it with a bunch of water and it just becomes watery, and you don't even have to notice that. And also I point out that aloe juice, what's generally sold as aloe juice, at least in the States, is like already watered down aloe gel. And I don't understand, it's so much more expensive than aloe gel when they're just adding a bunch of water. So I just always tell people to avoid that like the plague. You can make your own aloe juice by just adding your own water. That's really cheap. So
just the aloe gel that's usually sold for sunburns and things like that is what you're talking about?
Yeah, although some topical products have a bunch of weird ingredients in them, either
it would have to be 100
or whatever.
Yeah, it would have to be 100% pure aloe gel. I would think.
And you can definitely buy it in these big containers. Again, in the States, I don't know what the story is anywhere else, but it's real common here.
I think one of the reasons. Sorry, go ahead and finish your. One of the concerns that was always with aloe, and this may be more of a theoretical concern, and especially I'm less fussed when people are on antimicrobials at the same time, but there is a concern because of the mucilaginous substances like marshmallow and aloe and slippery elm, that there's some concern about the polysaccharides actually feeding bacteria that you're trying to kill. Now I'm sort of changing. I've changed some of my approach. I was quite militant before, and I see that people often do fine and do well with aloe. Sometimes not, but so just as a little flag for that. But I think very often the benefits outweigh the concerns.
Yeah, and I would agree if they're really acutely, clearly having SIBO symptoms, I definitely don't do this. I try to get the bacterial situation better under control before trying to address the leaky gut. Like I don't know. I would say I mostly don't try to do both those things at the same time, because I do think they run kind of counter. But yeah, I'm certainly I'll use the aloe in cases where there's not SIBO, but they have leaky gut, which is, that certainly occurs fairly often. Mm-hmm. Mm-hmm. Anyway, I was just going to say I typically do 2 ounces twice a day of aloe gel, before adding any water, so that that generally seems to be a sufficient dose.
I'm just trying to do it in mils right now. I've been in Australia for so long.
That'd be 60 mils.
60 mils.
60 mils twice a day.
Twice a day. Excellent. Thank you. Yeah, I say herb now. I don't say herb anymore. I don't see the point. Right. I don't see the point to it, honestly. Okay. Low secretory IgA. Well,
I don't know what to make of this. Everyone that I've ever done a stool test on that had that test said they were low. Granted, they all had problems. I haven't run it on random healthy people, but that makes me really nervous because there's other tests that don't come up abnormal in every single person in the world that every person that I've tested. So mostly I haven't specifically treated that result. And also, I guess I'm just not really clear that I've seen anyone have that result change. So I think there was a problem with the test and that we don't really know. I have seen some research that, this is a thing that can happen. So I'm not discounting that it's possible, but I guess I don't feel like I have any effective treatment or clear sense of when to do it or what's going on there.
One thing I'd like to say about that is that I saw the same thing when I used doctor's data stool testing, and I don't know if that's what you're using. It's a great test. I have no problems with that, but I switched over to the Genova GI effects test because I like to see the PCR analysis of at least a section of the microbiome and not just culture. I think that's absolutely essential now if you're specializing in digestive disorders and want to do stool testing. And I have not seen that at all to the same degree that I did see that with doctor's data in terms of the, secretory IgA levels often is actually high on the Genova. And often low. So I see a lot more of a variance, which gives me a higher degree of confidence that that's actually more reflective of the patient, But we always have to be vigilant of those tests that test positive for every patient. I automatically dismiss that test at that point. Okay.
That's problematic.
I think you were the one that told me, however, if you're using lactoferrin, that's a good one for increasing secretory IgA. And I think you were the one, or I read it somewhere, and perhaps it was even in the gastroenterology textbook that you wrote about. I think it was sarsaparilla or Smilax that has some effect on secretory IgA. Can't remember now if that was your text or not, but I often put...
If it was, I forgot.
Isn't that funny? Like when our brains can only hold so much information. True.
Well, that book is almost 2,000 pages long, so I don't feel bad that I don't have every single word memorized.
No, that's true. That's true.
Yeah,
but you can always look it up in your own book, so.
Yes.
Okay.
But I don't see that in there, so I think I'm okay.
All right. That makes me feel so much better because sometimes people say that I said something in a lecture and I'm like, oh my God.
I did?
I did? Wow. That was insightful. Okay. I think
another loop from before. I did find a paper while we've been talking of a formula that included a Berberis species from China and ginger. It was in rats, but they did clearly show that it was increasing motility. Oh. So we have at least something.
And this is small intestinal motility, or this is peristaltic action?
Okay. It was gastric.
Gastric. Okay,
so
good.
We're getting closer.
We're getting closer. Yeah. So this was this philodendron or coptis?
It was Berberis juliana, a species I'd never heard of before.
Never heard of. Berberis juliana. I'm going to have to look into that. That's really good news. And ginger, we know, does have motility.
Yeah.
So was it the ginger?
Yeah, who knows? It was all mixed together.
Okay, inflammation. Go. Or like, let's say, I think how I referred to what I wanted to know your thoughts on that is this is actually a good time to talk about your textbook, because I think it does such an amazing job of combining naturopathic principles and also laying out the conventional approach to a particular condition like inflammatory bowel disease. And you're a big fan of some of the old naturopathic principles like water fasting for acute inflammation. So maybe talk about that a little bit of that, and then also you have acute and chronic formulas. So rather than maybe listing a bunch of herbs, it's like how to gauge when a patient needs a water fast versus acute and chronic formulations.
Yeah, mostly I've done that. Use the water fast in acute inflammatory bowel disease, and you can't do it when patients are, extremely depleted. So if they're already severely anemic and they have, they're dehydrated and, when they're having 10 bloody bowel movements a day, that's just, they've already lost too much. So anyone that's lost more than 10 pounds during the acute flare, I won't do it. But if they're in pretty good shape, if they're not losing weight, they're not anemic, they've been able to keep their fluid intake up, they're not getting into a deficit, then I will approach it. Or more and more, I've just said, instead of doing a complete water fast, I'll do more like an elemental diet, or just with protein powder or something. So they're getting some calories, but with the minimal amount of antigens. And we have great evidence on elemental diets for Crohn's disease. It's really effective. But even more commonly is I'll do elimination challenge diets, because the idea is to try to find what is triggering them. And again, we actually have one of the only you can't do double blind, but one of the only randomized trials of an elemental diet in Crohn's disease, which is known as the East Anglia study that was done in England. And it showed that it was, as effective as steroids in resolving the acute flares, and far more effective long-term, because people would actually recover and get better. Of course, once you stop steroids, the problem is still there. It hasn't, gone away with inflammatory bowel disease. So I did go through that study in depth in the textbook. I've just seen some pretty amazing results. There's also the kind of, but that's helped me to see, and it sort of fits this idea that there are sort of subtypes of people. So we'll talk about the sulfur problem later. That's one subtype where there's a very different elimination diet for them. But also with some Crohn's patients, they're very clearly reactive to Saccharomyces type yeast. And there's a good, accurate blood test for that. You can just do IgA, anti-Saccharomyces cerevisiae antibodies. And I don't know, in my experience, it's maybe 10, maybe 15% of Crohn's patients test positive for that. And when you take yeast out of their diet, they are cured. I'm actually right now writing up about 5 cases I have of cured Crohn's patients, including 2 with more than 2 years follow-up with negative repeat colonoscopies. The disease is gone. Yeah.
Wow.
So I always hope they have that yeast problem, because it's so dramatically effective, but it's certainly not everybody.
I'm glad you brought that up, because that is something that is fairly sort of unknown in naturopathic circles, I believe, in Australia, and I'm not too sure about the States, but because one of the big stars or heroes of probiotics we use is Saccharomyces boulardii, which is practically the same as Cerevisiae, correct?
Yes.
And so
that would be absolutely contraindicated in this setting.
Yes. And I've sort of mentioned that to a few people that in different Facebook forums, and people haven't heard about this. So I'm really glad you brought that up. And that's very well written up in your textbook. And we've referred to your textbook a number of times. All the details will be in the show notes in terms of the references to this book. And I think you can get it. Is it on Amazon? Can't remember now.
It is.
Yeah, okay.
Yes.
I think you actually gave me my copy at the AANP. Because I had to schlep it back to Australia.
That sounds right. That sounds familiar.
That's right. I remember that. That was a few years ago. Okay. So now,
and if you, maybe we should talk about it after, but if you ever wanted to try to arrange some kind of discount for your listeners, I'm sure we could work something out.
Oh, yes. We will talk about that and put it in the show notes for details. Okay, great. So back to your story about IBD and some of the inflammatory or anti-inflammatory herbs that you use.
Yeah. So I'm going to start with glycyrrhiza or licorice because I'm so sick of people being afraid of this herb. I am going to right now put down a challenge and say this is the single most effective, most important herb out of all herbs on the entire earth. I'm going to go that far.
Wow.
And being afraid of that is insane. It is the definition of not thinking right. And I say that because it is used in multiple cultures across Asia, Europe, and now North America. And of course, now it's been spread all over the world. It's been used since before writing was invented, very clearly. It has so many actions. It's so effective, and we can easily use it in a safe manner. There's a safe dose, and it's so easy to monitor and prevent problems that And especially when we're using it in tincture or capsules, like the dose is not enough to really be an issue with the carbohydrates. Like there's not enough to matter. And, who knows if they're specifically FODMAPy or not, but it's really just a fantastic herb. And it's not just a liver herb. It's not just a lung herb. Like it really is such a great inflammation modulator, really, because it's partly working on the T cells and telling them to calm down and not overreact. And it's partly working on all the other immune cells that are more acutely, producing cytokines and things and causing the inflammatory reaction. So it's just really great. And I know not everybody likes the taste, but compared to a lot of other things, it's pretty darn pleasant for most people. So that I would say is top of mind.
And I think that's a good herb to list for Australian practitioners, because there is a fear here about the hypertension aspect of licorice. And so elaborate a little bit as to why that fear is unfounded, because I use a lot of it. I think in my 20 years of practice, I've maybe seen one case of hypertension with a solid extract, of using 2 teaspoons a day of a solid extract as a tea. And she it was for adrenal issues, and she loved it. But then we did notice her blood pressure did go up. But that was one case in 20 years.
Yeah. And I can't really say I've ever seen someone on my watch. I've heard of cases that I believe. But yeah, so I mean, all the reported cases really were from people eating licorice candy, which, like in Australia, where it actually has licorice in it. In the States, it mostly doesn't. It's flavored with anise. But it's like people doing it on their own, not realizing this could be harmful, and really overdosing on it. So it's an overdose phenomenon. It's the therapeutic dose of licorice does not inherently cause this problem. And again, obviously, it's like in more than 75% of all Chinese herbal formulas. Like, how dangerous could this really be? The entire country of China does not have hypertension, right? It's just no. So it's a dose issue, but also, of course, it's the way it causes hypertension is ultimately by depleting potassium. So and retaining sodium. So if you can make sure people are eating a nice high potassium, low sodium diet, which we want almost everyone to be doing anyway, because that's a high vegetable diet, you're going to help prevent it. And it's easy to screen. Yeah, you're just check their blood pressure. And if you're worried about it, have them check it at home. And so, because that is a very reliable early symptom that they're overdosed and they need to stop or, dramatically reduce the dose. So how are you using it? Just by it's like, are there other herbs that you put into your formula for if it's purely for inflammation? Oh yeah, usually there's other herbs there. It's rarely by itself, but often it's combined with ginger. Just again because they're so different in their chemistries and how they affect inflammation. And usually some people like one or the other of those flavors, so it kind of offsets the other one if they don't like it. What other things do I commonly use? Well, the Achillea I mentioned before, the yarrow. I do frequently use that. I like to use populus. So in the Northwest, we have Populus balsamifera, which is the black cottonwood buds. So that is, the resin that the bees gather to make propolis here. But I just say, let's leave the bees alone and let them keep their propolis and let's just go harvest it ourselves. And it is the season now here for that because we're in the middle of winter. So, towards the end of winter. But anyway, all the buds are coming out and they're real gooey. So also I like to promote that because there's so much focus on Boswellia and Commiphora myrrha, but those herbs, come from really seriously afflicted areas in the Middle East, and under very dubious circumstances. I don't think that it's clear they're sustainable, whereas populus is hyper abundant and so widespread. And I don't know. I generally promote that people should look to their local resinous plants rather than shipping them from war zones halfway around the world, Good and point. It works, even though, we don't have the research base, but it does work and it's well worth considering. So, populus has kind of a history as a respiratory medicine, but it definitely could work in the gut. I do use it in those. So another kind of what might be exotic to some people, but for me is just crucial, is Laurea tridentata or creosote bush, or a lot of people call that chaparral. That does not grow in that habitat, so that's a huge misnomer. But that is just such a powerful, fantastic herb for inflammation. That's also antimicrobial. And this whole thing about it being toxic to the liver is just, I don't know. There were a few cases reported in the 80s, and then there's literally been nothing ever since. So I just don't believe it. To me, it was just idiosyncratic, and it had nothing to do with the herb. It was just some random people had problems, or they were adulterated. Who knows? Because the case reports were such low quality. So I love that. That's really, really bad tasting, though. That's one problem with it. And but luckily, it's so strong. You only have to use a few drops of a tincture, per dose to get a strong effect.
Let's move on. We've got a couple more topics. One is interstitial cystitis, and that interstitial cystitis is one of the associated conditions with SIBO, and you're the expert in urology and natural treatment of the whole urological system. So tell me what you think about that, and what are your favorite herbs for that?
I can't even think of an IC patient that didn't have significant digestive problems and at least fairly often SIBO. So it seems hugely connected to me, and I am constantly frustrated by conventional medicine that just seems to write that off. It's just like, that's the symptom, but we don't do anything about it. Sorry, you're suffering. and they don't seem to want to ever look at the connections, even though there's plenty of research showing that this, that there is a digestive origin for IC. Anyway, I definitely do a lot of things we've talked about, but I also use either kava, Pipermethysticum, where I know that's not available in all locations.
We can get kava.
Or else there's that's great. There's also an herb that's more, it's actually, there's species that grow around the world, but Pedicularis is the genus, and I've mostly used Pedicularis bracteosa. Its common name is lousewort, and it basically does everything kava does, but it doesn't taste so bad. So I've really come to love that. So both of those are really pelvic-specific kind of analgesics. So who knows the mechanism, because no one has researched it, but they just seem to help with the pain piece of it. And it kind of makes me curious whether it might be working in the gut. But we obviously know kava has various effects that would, through the nervous system, that would explain pain relief. So I consider those fairly crucial. Another somewhat exotic herb that I really like to use is Eryngium yucifolium, or rattlesnake master, because it has the best common name.
Yeah.
But that grows sort of across the southern part of the U.S., and we use the root, and it is just a really great kind of inflammation relieving herb for the genitals and the urinary tract. So I've been pretty happy with that, and it's not a cure for any means, but just helping get the symptoms under control, to give sort of elimination challenge, diet time to work, or various other gut treatments to kind of work.
One of the sort of issues I face with people that have interstitial cystitis or chronic pelvic pain or urinary pain is that they often react to a lot of things and a lot of herbs. And I'm not sure if you've come across the same issue and have sort of herbs that work fairly consistently. Would kava be in that category?
I have seen it sometimes. I don't know. I wouldn't say it's common enough to say that it's common, but it has come up. And just usually what I do in that case is I don't formulate. I'll just give a bunch of different herbs, separately for them to try and see what seems to be tolerated. But yeah, it's kind of seems like it's been all over the map for me in terms of what herbs people didn't tolerate.
So I'm just wondering if it's like, I'm just wondering if it's like sort of tinctures compared to teas. I could imagine that teas are not going to be as reactive as, and maybe it's some of the essential, like definitely I've seen that with essential oils or compounds or products that contain essential oils tend to be, in my experience, a little bit more on the reactive side. But good to hear that you haven't seen that very much. Okay, very good. We're on the home stretch here. It's been really super fun talking to you, Eric.
Me too.
The last topic is something that I have really spent a lot of time in the last year looking at, which is hydrogen sulfide. And I won't go into all of my research and experiences with SIBO and also LIBO with the different bacterial or sulfur-reducing bacteria. I just wanted to hear your take on how, because you came up with it, you have a low sulfur diet, and what I like about your diet is that it's not so restrictive. You just take out the heavy hitters of sulfur out of your diet. There's numerous other diets where we go into the minutia of sulfur, and that can be really restrictive on top of an already restrictive diet. So can you talk about your low sulfur diet? I'm pretty sure it's in your book, right? And
it is,
also, and also what kind of herbs or what kind of approaches you would have to high hydrogen sulfide.
Yeah, so I kind of became aware of this when I was trying to figure out this whole thing about carrageenans in food causing disease and why that would be, because carrageenan-rich algae really are, like staple foods, and they don't seem to cause disease, seem to help it. So I definitely think it's only when the carrageenan is by itself, and that's there are sulfated polysaccharides in there. And so I found a bunch of research about how some people are colonized with these sulfur metabolizing microbes. So desulfo vibrio is the most well-documented one. And so again, some small percentage of, especially ulcerative colitis patients, again, maybe around 10%, seem to particularly have this problem. So they've got these desulfo vibrio, and they've adapted to using sulfur instead of oxygen to make energy. And that's one other note I have to make about these microbes that's just mind-blowing, is the only other place they're found on the Earth that they've so far are in those volcanic vents at the bottom of the ocean. And it's like, how did that same microbe show up in our gut and at the bottom of the ocean? Like, it blows my mind. Anyway, the byproduct of them using sulfur, then one of them is hydrogen sulfide. And we do make a little hydrogen sulfide as a neurotransmitter, so we can tolerate some, but as it gets to be too high, it becomes more and more of a problem, both as a dysmotility causing agent, but also even killing the colon epithelial cells. And so some patients just clearly do better away from milk, eggs, all dairy products, eggs, and the brassica and the allium, the garlic and onion type foods, and those are all really sulfury. And so it just became clearer and clearer that it's worth kind of doing this particular diet if people are kind of already noticing that. So I typically have them avoid all those things really, really strictly for 2 months. And I do want to emphasize that includes other animal milks. So goat and sheep still is fairly sulfur containing. And then usually they're quite a bit better at that point. Unfortunately, they kind of have to just stay on that diet indefinitely. There's no clear way to kill those bacteria. There's some in vitro work of antimicrobials killing them, but my experience is it hasn't worked, that they're still colonized. And I recently actually had a patient who had been pretty strictly sulfur-free for a couple of years with no flares of their ulcerative colitis, and decided to try bringing back a little dairy, and boom, got a flare. So it's a bummer, but at least, they don't have to take drugs, and they can, it's not the most restrictive diet in the world by any means. So they were pretty happy to just go back to avoiding the sulfur.
Yeah, so we have a couple of things to say about that. And because we also see hydrogen sulfide be an issue in SIBO, I just refuse to believe there's nothing we can do about that. And because it's a proteobacteria, it's a gram-negative bacteria, surely it should be responsive to some of the other approaches that we use for gram-negative bacteria, like for E. coli, for example. So I don't understand why that bacteria would be exempt from being affected by herbs that kill gram-negatives. So anyways,
I don't think it's exempt. I think the problem is, how can you totally eradicate it? Because that seems to be what has to happen.
Well, I think,
and that's really difficult.
Right. For the ulcerative colitis patients, there's a few things, because like I said, I've really sort of dove a little bit deeper into this topic over the past year, and I'm giving a presentation in the New Orleans SIBO Symposium or Integrative SIBO Conference. And one of the issues with desulfovibrio is that it loves a high-fat diet, and it loves like a bile-rich diet, or high fat meaning high bile, and so maybe that's another connection with ulcerative colitis as well. And then just some of the research showed that it actually did not do well on a low FODMAP diet. I mean, it did well. It thrived in a low FODMAP environment. So really, the issue is managing it. For me, it's just a bacteria. Like you said, it's an extremophile, and I do a lot of stool testing, and so I see it all the time that people have elevated desulfovibrio, and so then I use a totally different approach that I would use for SIBO, and that's been successful, or at least patient feels a lot better. So, of course, this is all sort of early days. We need to have a lot more people experimenting, and the more we understand about the microbiome and the interaction between these different species. I mean, we keep being sort of like we're not really respecting the entire milieu of the environment there. We're just looking at one bug, and we are so at the beginning of how these organisms talk to each other and how they interface with each other, that I think it's all going to be revealed as research goes on, and as I always think that practitioners, we're on the coalface and we can't wait for research. We have to do, this is the wonderful thing with herbal medicine, is that you can use your logic, use your sort of systems thinking, and you can come up with a treatment plan that very often helps our patients, I find.
Yeah, agreed.
Right. Any other pearls of wisdoms, Dr. Yarnell? This has been so great. And I have a lot of other questions, believe me, but we usually limit this to our listeners' patience to just an hour or less.
Sure. I think we hit a lot of good points there.
Okay. Well, thank you so much. And I hope to have you on the podcast again at some other point. We can talk about some other, we'll pick out some other topics. You know, there's so many different things in that book that are, constipation. But let's actually, before we wrap up, let's just have a couple of herbs that you find are great for constipation, because I often use herbs as an addition to my protocol for my methane dominant patients, just to alleviate their symptom until we reduce methanobrevibacter. Do you have any favorites in that department?
Well, I would say again, this is the place where the bitters shine, certainly the Artemisia, because it has that overlap of the antimicrobial effect, and potentially also the Andrographis. I think you had brought that up earlier, because it's both bitter and antimicrobial. And I've played around a little bit with Anomopsis, another sort of Sonoran desert native plant that's Yerba Mansa, which is another real interesting bitter antimicrobial, but just a very different family and chemistry. So that one I think should not be overlooked where it's available as well.
Excellent.
And,
thank you very much for that last bit.
You bet.
Did you want to say anything else about that?
I was just going to say that it's important that I use it as also a trick to get people to sort of engage their parasympathetic, right? Where we're supposed to relax when we're eating, and we so often eat on the run, which is so not effective. So it's like they have to stop and like take their drops of these bitters and put them in water, and they have to sip on them. Like I make it kind of difficult so that they can't do it on the run.
Wow.
The trick is
that's a good one.
They have to relax. Yeah.
Wow. That would be stressful for some people.
Yeah, and I tell them that it's like the real trick here is making you take a break to eat. And some can do it and some can't.
That's a really good point. All right, now we really have to wrap up. Thanks again, Dr. Yarnell. And again, all the, before we go, tell me where, or tell our listeners, because sometimes there are patients, where they can find you, and all the details will be in the show notes.
Mm-hmm. Well, my practice is called Medela Optimal Health. So you can find that online, but just Googling my name will get you there. And my little company is Heron Botanicals, and also at Bastyr. I'm very findable.
That's true. And just before we go, I have to tell listeners again, if you really like this podcast, if you can please give us a review on iTunes. If you don't know how to do that, the instructions or directions are also in the show notes. So thanks again, Dr. Yarnell, and I'm sure we will cross paths again in the near future.
My pleasure. Thanks for having me.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.